Hi, and welcome to our first team Inservice. I'm glad you could join us. I hope you had a chance to introduce yourself to our team in the course discussion board. If you haven't done this, please make sure you introduce yourself as a matter of priority. It's always good to know who is learning with us. When you attend an in-service or education session in the healthcare setting, you'll be asked to add your name and your location to the sign-in sheet. You'll also be asked to introduce yourself to the other attendees present. In this first in-service, we'll learn about the beliefs and philosophies of interprofessional care and the role education plays in its collaborative process. We'll also discuss the relevance of the client-centred reality in the Canadian healthcare setting. After this in-service, you should be more equipped for success in critiquing the concepts. You'll also feel better able to apply what you've learned to the Module 1 case scenarios, as well as being able to test your knowledge in the quizzes and activities that will follow. Today we'll set the foundation for some of the key themes of interprofessional care. Communication, collaboration, patient-centred care, team functioning, conflict, and your role in the healthcare setting. But first though, let's see where the idea of interprofessional care came from. Traditionally, medicine was focused on the medical model, which didn't provide optimal client care. Clients felt left out of the plan of care. The 2002 Romano report gave recommendations for a collaborative healthcare team approach to improve client safety and health outcomes. In 2008, the Ministry of Health and Long-Term Care recommended interprofessional education for all healthcare providers. Currently, hospital accreditation has interprofessional care and interprofessional education of the staff as a core component for success. Since 2004, interprofessional healthcare teams have been working to improve education, team process and collaboration. National and international conferences draw thousands of healthcare leaders and providers to learn how to improve collaborative practice. Presently and going forward, research and practice continue to have a great impact on clients and staff. Professional organisations were early adopters and have accepted interprofessional education and interprofessional care as part of our healthcare workforce expectations. Canadian educational institutions are committed to provide interprofessional education so students will be collaborative practice ready to join healthcare teams. There are numerous definitions of interprofessional care, and this one by Healthforce Ontario sums it up well. Interprofessional care means that team members work together, talking, planning and organising. They seek out the client's goals, create their own professional goals and integrate them all into the overall interprofessional plan of care. Team members use knowledge utilisation of each other's roles and responsibilities when implementing their plans. They use shared decision making to meet goals. Benefits of interprofessional care include increased client safety, improved client health outcomes, and improved staff satisfaction. In the coming weeks, you'll find out how that happens. Interprofessional care doesn't happen without intention. It doesn't come naturally. We need to learn how to manage in teams, how to communicate, resolve conflict, and how to collaborate successfully. The World Health Organization tells us that interprofessional education occurs when learners or professionals from two or more professions learn about, from, and with each other to enable effective collaboration and improved health outcomes. Interprofessional education, or IPE, is instrumental in creating a collaborative, ready health workforce. Learners are better prepared to respond within healthcare teams. Complex group dynamics are managed to enable improved team functioning. And the World Health Organization identifies IPE as an innovative strategy that will play an important role in mitigating the global health workforce crisis. The Canadian Interprofessional Health Collaborative was formed to further understanding of IPE and has active members across Canada. They developed a competency framework that healthcare facilities throughout the world apply to their own organisations. The CIHC is instrumental in supporting interprofessional education conferences to disseminate research and practice occurring internationally. The CIHC National Interprofessional Competency Framework helps us reach our goal of interprofessional collaboration. The framework competency domains include patient, client, family, community-centered care, interprofessional communication, role clarification, interprofessional conflict resolution, team functioning, and collaborative leadership. The way it works is the two domains that always support the others are around the outside of the oval. So patient, client, family, community-centered care, and interprofessional communication. The four domains within the whole are role clarification, interprofessional conflict resolution, team functioning, and collaborative leadership. The two supporting domains always influence the other four. For example, interprofessional communication impacts collaborative patient-centered care in all situations. At the centre of the framework, we aim to achieve our ultimate goal of interprofessional collaboration. Client-centered care is at the core of everything we do in the healthcare setting. When we talk about client-centered care, it may also include the family and community if that is the wish of the client. The client's concerns are of primary importance. We explore their need for more information in an attempt to understand the whole person, to understand their world, their emotional needs, and their life issues. Client-centered care reaches a common understanding of what the problems are. A client-centered focus enables and enhances health promotion. It finds mutually agreed upon health management and enhances the continuing relationship between client and care provider. What we expect to see in a client-centered environment is improved patient outcomes, enhanced patient satisfaction, positive benefits for health professionals, a positive impact on healthcare costs, resulting in fewer malpractice claims. Let's take a look at healthcare from a client's viewpoint. Go into the DVD library for this course, then go to the DVD labelled Reflections on Interprofessional Care. Find the patient statement and watch the video. Carol has a very interesting perspective on her care journey. As you watch the video, think about the following points and questions. How did Carol's care impact her recovery? What were her goals for her recovery, and how are they different from the goals of her care providers? What do you think the team could have done better to meet her needs? Make some notes and be prepared to bring them to a discussion later in the module. Thank you for coming to the Inservice. I hope you found it interesting and that now you feel more prepared to apply what you've learned to the Module 1 case scenarios as well as the Test Your Knowledge quizzes and activities. See you at the next Inservice and have a great nursing shift.